Good afternoon and welcome to Coronavirus Managing COVID-19 in Facilities. I'm your host, Troy Raszka, and I'm the Vice President of Marketing and Communications for Pure Air Control Services. And with me again this afternoon is Dr. Rajiv Sahai. He is the Laboratory Director of our own Environmental Diagnostics Laboratory.
Welcome to all of the participants. I know that some of you are in a really far away from the United States. Some of them are like around the globe. Some of them are from India. For our viewer in India, namaste. We are going to discuss today the coronavirus. As you know, this problem is not for one country. It's over 200 countries is being affected by that. So we'll be giving some information on how to manage it, especially in the indoor environment.
That's correct, Doc. So we're going to briefly cover the background of Pure Air Control Services and the current pandemic. Then we're going to get into coronavirus and COVID-19, how it transmits both outside of the building and inside of a building environment. We're going to look at the management of it and then what kind of considerations and next steps that you need to be thinking about. So just a little bit about Pure Air Control Services. We were founded in 1984, and we have three specialized divisions. So that is Building Sciences, that does IAQ and environmental testing within the built environment. Doc's own ED lab, and then we have a Building Remediation Sciences division that goes out and corrects any of the issues that we find in the buildings. So all told, we have over 600 million square feet of experience in well over 10,000 buildings. And we service all types of commercial and government agency buildings, education, healthcare, non-for-profit. So you name it, in any kind of commercial environment, we've been in it, we've worked in it. So we have all the credentials and industry standard certifications needed to perform this kind of work. We're also affiliated with many different associations and organizations like the Florida Healthcare Engineering Association, the Association of Energy Engineers. All of our building remediation folks are NADCA certified. And of course, the lab has accreditations with the New York State Department of Health, and they participate in the CDC Elite program. So beyond that, of course, and we're going to talk about this more towards the end, we have cooperative purchasing contracts for our city, county, state, federal government agencies, as well as our educational facilities, and we do have a GSA contract. So we'll talk about that in a little bit. So Dr. Sahai, let's inform the viewers a little bit more about what coronavirus is and specifically what is COVID-19.
Thank you, Troy. It is really necessary. I'm actually going to recap because many of you are already aware what is coronavirus. So as you understand that it is an infectious agent, but it is only viable or only living when it is with host. Because if it is not with the host, then chances are that they are not like, infectious material sitting there unless and until it come in contact with the host, and again it will be like infectious. So the coronavirus is a type of virus. I just explained you what a virus is. Well, this is very important here to understand that how it looks like. So as you can see, this is sort of like a spherical structure, and it is like pleomorphic because this is not a very rigid wall, but what it has a genetic material which is RNA inside this capsule, if you would, like a rounded capsule, and then it is all the body of this virus is made out of the protein. So this is basically, as any other virus you can think, made out of protein and a genetic material, and in this case RNA is the genetic material. Now why we call it coronavirus, that a lot of person asked me that in past. The coronavirus, the name is being driven after doing the Latin treatment of crown. Crown in Latin is corona, and in the biological nomenclature system we Latinize the term, and that's why the corona is there. So that is called as coronavirus. As I inform you that there is only one little strand of the RNA. So there is only one strand inside the RNA, just one RNA. You can understand like that. The important thing is that this particular virus, as I'm on my slide, you can see, is zoonotic. What zoonotic meaning? The zoonotic meaning it can transfer between animal to person, and that's what the zoonotic. So the tracing of this virus is still under investigation, and a school believe that it is coming from some kind of animal. The suspected animal is bat here to the human being. So that what is being believed, but there is no confined or no confirmed decision on that. But absence of that, this virus in the scientific world is known as 2019 nCoV2. This is the strain which is responsible for a disease, and that disease everybody is knowing the word COVID-19. I would be surprised that even a third grader or second grader may not be knowing this name COVID around the globe. It is not only in the United States, but over 200 countries, and the World Health Organization has declared it as pandemic as of March 11, 2020. So I think with this background, we are going to give some more information on this particular virus.
That's correct. Now let's take a look at how it is that this virus is transmitted, not only with person to person, but how does this get in a building and how can we be infected by it?
I'm glad that each day we are getting some new information and we are educating ourselves, and so do we want to pass along to the end user or a person in a society, so that he cannot be just having no right information. So what it means, the transmission, as you understand that how it is going to travel from one host to the other host, meaning if you are susceptible or you are resistive, no matter what, if you are getting the coronavirus, what is the route? Well, the route of this virus is still in progress. World Health Organization has taken two positions. As of latest, they are also going to think that this may be airborne, but still this thing in under consideration. But basically, so far we understand that this virus is spread from person to person by two main routes. One is the aerosolized or airborne form, and that basically from the respiratory droplets. As you can see that when you cough or sneeze, then there is the excess of the droplets coming, and that droplet is here. You can understand that it is like a water pond, and these are the fish inside. So the virus travel in a small droplet. The size may be 5 to 10 micron, and that is packed with the virus. And then this travel, and as you can see that if somebody sneeze, that put lot of these kind of droplet, and then the people from the other end or the person on the other end may get exposure basically with the inhalation if it is the respiratory droplets. But at the same time, a new study come. It is a very interesting. That's why I'm going to bring under your information that author like Santa Priya has come up with an idea, and they have done some paper and research. And according to their research, it is being proven that the genetic material or the virion of this virus was assessed in air and surface both sample. If I take a statistics from their paper, they are suggesting out of 163 sample, they have noticed 126 sample positive, which is over 77% of the sample. Well, all these samples were collected to the corona infected person vicinity in the isolation room. The number of patients were 13 where this research was conducted, and they noticed that out of which 76.5% of the personal item were contaminated with this virus, and they were successfully able to isolate it. The other interesting fact in this paper is that they have also identified and confirmed the RNA or genetic material or so-called virion from the ventilation gate. So that is very alarming. They also suggest in that paper that the concentration of this virus was a little bit higher in the hallway in their confined area in the room. So these are some interesting findings by that author. I'm not going in that detail, but I just want to make sure that you understand that the World Health Organization starts seriously considering and going to study about the airborne nature of that, and then they will be releasing for the airborne precaution. That was about the airborne. Now this virus can also spread with contaminated surface and objects. So if you are in contact, or if around you some object which is already been contaminated due to preset of this virus or virion, then you are going to acquire it. And as a human being, we have a tendency to put your hand all the time on their face. I don't know whether you like to be like look beautiful or what, but I guess all of us do one time or the other, like taking our hands and putting on our face. And that is basically a dangerous thing to do at this time, because you never know that whether the virus is in that surface or not, and especially in the hand. So again, I'm not going to discuss a lot on that, but just be aware that your hand is one of the surface where this virus can live for a long time.
That's correct, Doc. And the paper in reference, the title is Transmission of Potential SARS-CoV-2 in Viral Shredding Observed at the University of Nebraska Medical Center. And so if you wanted to look that up, that would be through the University of Nebraska Medical Center. So now that we know a little bit about how it spread, including the new information, let's take a look at what we can do to try to prevent that spread.
That's a very good question. So preventing is better than intervention. So what we need to do for that, real quickly, I want to touch, because we have to cover a lot of things today. So first thing, everybody should increase their personal hygiene. And I'm not going in that detail, but I would definitely recommend, so far the personal hygiene is concerned, you should be washing your hand very frequently. That is called as 7-point washing. So 7-point is there. You can find easily that resource available with the World Health Organization, that you can use soap and water to do that 7-point action to clean your hand very frequently. People say at least you should be doing one turn every hour if you are in that kind of situation. Now, the very good information come when we talk about the social distancing. So adopt solitude is the option at this time, because we do not know a lot about this virus. There is no line of treatment known. In absence of that, these three mechanisms which I am narrating here, people already start doing as a country, as an individual, but social distancing is one of the things by which we can limit the spread, if not finish. So social distancing, when you should be not coming in the vicinity of other who is either suspect or they are suffering from the coronavirus or COVID. How you are going to find, that's the hard point, that you will be not sure that this person is either suffering or is a carrier. So it is better to just maintain the distance, and that the distance which they are recommending is 6 feet. Basically, this virus can travel in air through the respiratory droplet about 3 foot. So we just make a doubling effect 6 foot just to be safe side. Quarantine is another way that you should not be rude with anybody, but you should be pretty much enclose yourself, and then you limit the communication with your outer world. That's another good way to spread or stop or minimizing the spread of coronavirus. The other one is the isolation. When you are a known case and you know that you are suffering from this, then you can be isolated either in the hospital, in the nursing home, in your home, or in your room. So these are the best way. And what is the basis what I'm saying, that you can see this graph right here, that is called as flattening the curve. So if you adopt this thing, this help to create this flattening, because what happened if you don't adapt and everybody at the same time is going, then there will be more spread and there will be a very big spike right here. And in any country is not 100% one-to-one healthcare. So their maximum stretch of the healthcare is right here. And then there is this much of case. So how about this much people? They are going to just not going to be attended medically, or they are not going to get any kind of help on that. So it is very, very, very important and help everybody to please, 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 please do these three practices to help your country, to help yourself, to flattening the curve. Now, the person, unfortunately, there are a lot of person who is taking care of other who are sick. In that case, they have to have a personal protection equipment. I highly recommend that you should not be going in the vicinity if you do not have the personal protective equipment. And again, I'm not going to talk length on that, but at least minimum you should have a respirator, mask like N95. I guess everybody knows these things, like full gown suit, your gloves, etc. And then obviously the goggles so that you cannot get the eye contraction with that. Then the other very important thing I want to bring here is manage your anxiety and stress. I understand that you guys are, or everybody including me, is like every morning thinking when we are going to have our regular life back. And then there is a lot of anxiety that what is going to happen, whether I'm going to have my job or I don't have the job. I'm mentally stressed. So please try to control and try to console other. That is the best way that we are going to come out of that.
That is absolutely true. It's all over the news. Most of this stuff is just reinforcement at this point for all of you. And of course, we know many of your buildings are empty. Of course, the buildings that aren't empty are the first responders, police, EMTs, healthcare workers, and those that are servicing them. So please adhere to what your local governments, state governments, and federal governments are asking you to do. So now that we've covered the transmission, how to eliminate the spread at large, let's take a look at the environmental concerns that we have when we start really looking at the built environment. So indoor air quality, indoor environmental quality, and how this COVID-19, this coronavirus can affect the indoor environment.
That's right, because there are certain concerns in the environment. So if you are aware of that concern, then I guess you are in position to respond. If you are not aware, then what you are going to respond? So I'm going to bring, because it is out of sight, out of mind. Many of you know already these things. I'm just going to remind you that these are the concern. You should be very vigilant about this concern. The very first and foremost concern I want to bring here is the high touch surfaces or objective. Many times people are asking me that the objects and the high touch surfaces, how it is being concerned. Because as I told you earlier, that this virus is coming in your closed environment, in your closed air, by respiratory droplets. Not all the droplets, because I also mentioned to you that their size is going to be vary from 5 micron to 10 micron, but some of them are not going to travel far. As I said, majority of them are going to settle. And where they are going to settle? They are going to settle on the surface or the object where this droplets is going to touch first, isn't that?
That's correct.
So what we need to do about it, because that surface become contaminated, and if you come in contact with that, people already know that it is transmitted through contact. So you will be having contact, you will be transfer that virus or virus particle on your hand, you are going to touch your face with your hand, and you will be end up getting that virus. So the viability of the question is that how long it is viable. I want to bring some more information. As I said you that each day we are learning something new about the viability. Last time I was telling you with authors experiment that it can live up to 9 days. Basically that experiment was done in a hospital environment, the cloth and everything was considered, but there are a lot more information is now available, and I'm going to give you some good example of surfaces. Again, we have to cover a lot. I'm sorry, I cannot go very specific, but on the glass it can be up to 5 days. On aluminum surface it can be 2 to 8 hours. On the copper surface, copper, remember copper is one of the antimicrobial, on that it can be about 4 hours. Cardboard in 24 hours. That's why the cardboard is used for making the mailbox and things like that, UPS box and things like that is made out of that. Stainless steel, it is going to be 2 to 3 days. For plastic, again, it is going to be 2 to 3 days. Metal, it is going to be 5 days. Wood, it is going to be 4 days. ceramic, it is going to be 5 days. So that means that this virus is going to be there, and obviously if they come in contact with the air, then it can be also like going in the HVAC and air conveyance system. And again, Centropia and its colleagues has reported this virus airborne from the air ventilation. So we know that this might be end up in the air circulation. So again, if you want to read in detail, Troy has given you the information on the paper. If you are interested, we can always supply that information to you. That paper is under progress, under consideration, and it is going to be published shortly, that we hope in a referred journal or in a review journal.
So Dr. Sahai, as we explained earlier with the actual coronavirus and how it's biologically made up, this virus needs some sort of food source or energy source to be able to live on these surfaces for these amount of times. Is that correct?
Yes, that is in absence of a very clear-cut information that is being assumed that you should be having some favorable condition, what we call as a microbiologist, and that include but not limited to two very vital factor, and that is temperature and humidity. So we will be talking about that a little bit later in this slide. And airflow and pressurization is another thing, because it also depend, or you can hypothesize that if it is sitting on a surface, meaning that virus is sitting on a surface, that if the air current or turbulence in the air is going to disturb that or going to blow away with that or not. That is the another question which we have to think about it. And then the particulate matter, that another biological or abiological particulate which is already in that particular environment, is going to help or not. Most probably this is going to, because as earlier we have explained that virus require a host in order to continue their life cycle.
So these underlying building and IAQ conditions or issues would have a direct relationship with the virus spreading in the built environment.
Exactly, and like I said earlier, that the relative humidity and the temperature is two important factor that play in the life cycle of the virus. As you can see here on this slide, that ASRE 2016 book, it is being said that 50% RH influenza virus lost virulence, because what it's telling you that there is some kind of relation between the moisture and the virulency of the virus. Microbiomes of the built environment is also affirming that 50% RH kill 100% of airborne influenza within 24 hours. That's a very good information. I also want to bring one more reference why Casanova and their colleague has found out that there is a direct or greater effect of viral activation based on the moisture and the temperature. So they have tried different moisture and combination. So in this particular graph, as you can see, that if you are maintaining the relative humidity between 30 to 60%, you are covering the risks of virus very minimal, because some of the virus cannot even grow in that range. Make sense?
It does make sense. And if you look at this chart, this also takes into account a lot of other factors that contribute to the quality of the indoor air or indoor environment that we work and go to school in and live in.
So, and that's what happened, because I said if you are not only, you have to maintain the humidity either less or more, because if it is between 30 to 60, see in the graph I'm showing you, that is the optimal zone for the growth of various microbes, or they are going to flourish. So if they are in this zone, then they will be struggling for their growth. So please make sure that you maintain the humidity, and still there is a lot of different organism, there is a lot of different factor. So I cannot come up with one scale that, hey, you maintain 60 degree, you are good, or you maintain 60 degree and 60% humidity, you are good. So there is no such kind of information. In lack of that, the humidity is also going to go hand to hand with the temperature. So there are a lot of information. Maybe we will be presenting this aspect in some of our coming webinar to exclusively talk about the impact of temperature and moisture, meaning the humidity on the virus growth.
So can bacteria or mold, fungi, can that be considered a host for these types of viruses?
Not exactly for the COVID-19, but the general understanding in microbiology is that yes, because bacteria and fungi both are living things, so virus can be like live out of it.
Understood. So that brings us to how to manage this within your buildings. And so now we're getting into more of the facility management aspects of this now that we have the good background information. Thank you, Dr. Sahai. And so we've adopted this method of find, focus, and fix, which sort of emulates how Pure Air Control Services is structured with building sciences, ED lab, and then our building remediation team.
Exactly, because many a time our viewer or will be wondering that why we are coming with this find, focus, fix. With my personal experience here working in the laboratory all the time, I'm getting some question and queries, and I start studying that how to respond that, especially this COVID-19 situation. Then I think and I deem necessary that if we going to provide a total management of environment so far responding to the COVID-19, then this is going to be three main factors where we have to focus. The first one is a find, meaning that you have to find that what problem or what situation you are in. Then we are going to narrow it down. We are going to focus exactly that how we are going to help you, what we are going to intervene, that you are going to be helped. And then obviously our goal is to fix. So we are going to fix all those problems or all those potentially identified problem with different technologies. So that's why we come up with the formula find, focus, fix for the building. And I guess it is going to work.
That's true. And so in this section and the conclusion of the webinar, we're going to look at building hygiene and performance, planning and important data, cleanliness verification, which is new for us and ongoing. We're going to look at the disinfectants, and then we're going to take a look at our multi-leveled approach. So as we were saying earlier, we're sort of building the case that building hygiene and performance can have critical impacts, not only on this virus, but with a lot of your buildings being shut down now for 30 days. It might be another 30 days. It could be pushing 90 days, that we don't want to encourage you to just lock the door and walk away from your building. Put the HVAC system on setback and raise the temperature and humidity of those buildings. We want to make sure your buildings are clean and performing at optimal levels so that when your occupants come back and are ready to go back to work, go back to school, that the building has been taken care of and is ready for them to return, and there's no other issues like mold, odor issues, humidity issues. So that's one thing that to consider. Of course, if you're facing an issue right now with COVID-19, then we have to be prepared to act and to jump into action, deploy, and help you fix your problem. So the focus part comes into play. Not only are we finding and looking at the underlying conditions of the building, but now we have to focus on what the exact scenario or situation you're facing is. So we've developed 2 questionnaires that when you come to us for a consultation or we're talking to you, that we're going to ask you a series of very specific questions to help us get to the right plan to execute for your situation. And so these are just some of the types of questions that we're going to ask you that you're going to have to be ready to answer so that we can act very quickly to get into cleaning this environment. And so this is sort of something relatively new, not to indoor air quality, but to this situation that we're developing currently to help provide verification before and after we go into your building and clean it. Can you speak on this, Doc?
Yes, because this I have come up with this plan because past couple of weeks or so going crazy here, lot of query, and people at any cost want to know that whether they are safe, their built environment is safe or not. And at this time, I believe under the given situation, I come up with this plan so I can give some extra ease to the end user or to the occupant of the building that they are covering the least risk. In absence of a specific test which identify COVID-19 causal organism 2019 nCoV -2 virus, we want to make sure that the environment which you are discussing or you are living in or you are utilizing is otherwise very, very, very clean. When I use the word clean, meaning it is a subjective word, clean in terms of what? So clean in terms of other particulates, maybe abiogenic, maybe biogenic, so that you are going to cover least information, least risk, because if there is no supportive condition, the virus is going to die pretty soon. So to verify it, because first we need to make sure that what condition the building is currently. So what I wanted to propose for that we do two different kind of tests. One is meant for the surface, other is meant for the air. In the surface, what we do, we try to collect the data on the protein residue, because if there is a life or there is some kind of living organism on that surface, they are going to have some residual in terms of protein. So that's what we are going to monitor. Now, the other thing I want to do with that is we are going to monitor the biological indicator molecule, such as ATP and etc. Well, virus doesn't directly have ATP, neither it produces ATP by themselves, but when they are in the host, then they multiply exponentially, and then in that case, that particular host, whatever it may be, is going to shed lot of ATP. So if I collect that data, that will be telling me that what kind of situation that particular surface is facing. At the same time, I'm also trying to get some information on the other living microorganisms such as bacteria and fungi by isolating from that particular surface, so that I can be assuring our customer that you are not a greater risk, because as I said that the virus is not going to grow without the host for a long time, and I was reading you their longevity on surface on the different material, etc. In case of air, this is also very interesting stuff, because in the air we are again going to find out that what is the concentration of bacteria and fungi, and if that is there, then there is a more chance than not that you will be having some chance of acquiring the virus. The same time, I want to also trap various type of spore, both biogenic as well as abiogenic, in the surrounding environment. So in absence of a very practically applicable test for doing coronavirus, this new strain, in the surface or in the air, there are technology, but some of them are not practically applicable at this time. Until that time, these two tests are very important, and you should be taking pre and post, so you will be knowing that whether your cleanliness effort or remediation effort, how successful it is. The virus at this time can test only with the PCR technique or antigen antibody technique, which is not very suitable to apply in the indoor environment at this point. That's why I'm coming with this idea.
Very good, Doc. And I do think that this is a very good proactive measure to take a look at what's going on in your environment, and to also take a look at what's happening after we've come in and remediated for basically any of these situations, not only COVID, but mold, bacteria, and other situations. So as we move towards looking at how we're going to come in and remediate, the occupied space, should you have an issue with this, we want to talk a little bit, but not too long, about the disinfectants for emerging pathogens, or the disinfectants that we're going to be using in some of the equipment. So the EPA has activated its emergent pathogen policy, which is an application fast track and registration policy for manufacturers and vendors of disinfectants that have already registered with them. And so basically what this policy does is that it looks at what the previous registration's efficacy was supported. So if it was able to disinfect organisms that are stronger or more resistant than what a coronavirus type of virus would be needing, then it's fast-tracked and the EPA has green-lighted it. So basically, that's what the disinfectant for emerging pathogens is. So based on our current demand and supply chain, we have different applications that we're using that we're going to get into here coming up. So we use different types of disinfectants for the different applications. And so that might be electrostatic spray. It might be a disinfectant used for topical cleaning, for the inside of ductwork, depending on what the material the ductwork is made out of. And then, of course, different treatments that we would put on the evaporator coils. So as you can see in this chart, this sort of gives you a very high-level overview of what's most susceptible to disinfectants and what's most resistant to disinfectants. So again, since this novel coronavirus, since it's new, a lot of efficacy testing on these disinfectants hasn't been directly done, but again, by the EPA standard, if that disinfectant can kill things that are, or inactivate things that are more resistant than what coronavirus is, then the EPA is green-lighting it. Again, as we said earlier, Doc, when we looked at the physiology of this virus, it is an enveloped virus, so that categorizes it as one of the most susceptible viruses for disinfectant. So right now, as we're going into 30 days almost with this pandemic, we've had quite a few cases where we've gone in and helped our customers, old and new, disinfect their buildings. And in fact, we're doing this in our own facilities since we've been deemed as an essential business because we're supporting healthcare, first responders, EMTs, grocery stores, all of this. So we've done city halls, we've done police departments, we've done you know, all kinds of first responders, universities so far. So that being said, our main part of our PURE-Decon service is comprised of two different types of equipment and applications. One is our handheld electrostatic spray using a registered DEP, and this focuses on high-touch surfaces. There's no harmful byproducts, so the disinfectant decomposes naturally in the space. This is an agile and tactical method, so we can go around and be very tactical about what areas we're hitting. And of course, this can be used as a routine or proactive measure, and that's what we're doing in our very own offices. Then we have a total environment mister application. So we would set up containment, and then we would mist or spray the entire room with this disinfectant. So it's a treatment of an enclosed space. This takes a little bit more time depending on the size of the space. But in both cases, this disinfectant works anywhere that this mister spray permeates, even hard to reach.
And then it is like, you know, hard to reach surface. It is going to cover more surface area in the less time, because time is essence here. And as you understand that this droplet size is very small, less than 50 micron, I would say, in these kind of situation. And this is going to cover, like, you know, most of the surface area, both front or any hard to reach surfaces, or maybe the entirely reverse or angles and things like that. So that is going to settle and cover that area to subside the contaminant, whatever it may be on the
inside
surface.
of textiles, in between keys on a keyboard, a phone pad. So basically, this is how it works, right? An electrode atomizes the disinfectant's particles. It creates a charge. They wrap around each other, and then as it's sprayed, so it's not like a hand sprayer or pump sprayer. It comes out with a good force. It's able to be attracted to these surfaces and go in between the crevasses inside of textile fabrics, and really adhere to these surfaces and inactivate the virus. So we talked a little bit earlier about how this virus can get into the HVAC system and the air conveyance system. So in conjunction with our electrostatic spraying and topical cleaning that we also provide, we do deep cleaning of the air handling units and the evaporator coils. So our pure steam process is a detailed specification. It's eco-friendly. So it's just basically using water, although we do have pre and post steam bio treatments that can be applied directly to the coils. And we provide full measurement and verification testing data and photo logs with every single service that we do. So you're getting that assurance as well. So before, after. And again, with our PURE-Duct service that we use in combination with our multi-level approach, we operate under full containment. We can spray or mist the ductwork with the disinfectant. And of course, we are NADCA and ventilation system mold remediation certified. So we know how to work inside the air conveyance system at a very, very high level. So as you can see, between the coils and the ducts, there's particulate matter, there's buildup, which the virus can adhere to and find hosts in for longer viability. So we're almost wrapped up here. And this is the basic overview of our multi-level approach. So, you know, level 1 is going to be a tactical electrostatic spraying. Level 2 builds on level 1. So each of these subsequent levels takes the level previous and puts it into the mix. And from level 1 to level 5, it's becoming more and more and more thorough. So, you know, any of these levels can be added to or subtracted to or customized based on your scenario, based on your building and what you need. So all of the work orders or project specs are going to contain the full scope of work, what kind of equipment we're using, what the disinfectants we are using, and we'll outline exactly what we're going to do when we come into your building and work. So, you know, I mean, that basically about does it. As you're considering what your current scenario is, here's a few things to take into account. Again, GSA is offering simplified acquisition procedure, so SAP. So we have a GSA contract. If you use the GSA, it's going to green light up to $250,000, no bid, get started right now. The Stafford Act, Section 502 and FEMA are also providing money and resources to help decontaminate your buildings and take care of these issues. And FEMA's paying, I believe, up to 75% reimbursement on that, right? We have cooperative purchasing for education. So we have 3 or 4 different cooperative purchasing vehicles that do include these services right in them. So what you need to be thinking about right now, are you wanting to be proactive? Do you have any current COVID-19 related issues? Because we can get started and help right away. So, and do you have any other plans relative to our services? Your buildings are now unoccupied. So now would actually be a pretty good time to clean that ductwork.
This is very good time to maintain your facility. Like, you know, you are having downtime, so you don't have to worry about the productivity and all. At the same time, you will be like providing a better health and better environment for your worker when they show up for the work. So you will be enhancing actually the productivity, is it not?
That's true. And then if there's any other people that you feel we should be talking to, drop us a line, let us know. And of course, if you have a specific need right now or a spec, we're happy to take a look at it. So
I guess at this time, Troy, we have done with our presentation and the forum is open for the questions. And well, we don't have a lot of time for responding the questions, but we will be keep responding as long as the time permits. But do not sigh, do not like get hesitant. If you have any question, any idea you want to share with us, please start using the chat button and start typing your question. If you have this question ready, that's fine. If any question come in your head afterward, you can always email to us. Both of us is listed here and the contact email is given.
Okay, so we do have a few questions, and one of the questions is about UV exposure to inactivating the virus, and specifically UV that might be in HVAC air handlers.
Yes, so the question is regarding the UV. The UV is like, you know, antimicrobial. Yes, it is being like, you know, tested, but the problem with the UV is that like it doesn't give a very big inner penetration. So it can clean like, you know, the superficially or however long this UV can penetrate in the material. But on the other hand, if you are thinking about a coil which is like, you know, 12-inch thick, and the penetration capacity of the UV light which you have generated with a certain frequency is not going to go any deeper than 2 to 3 inches. So what happened in that case? In that case, you push the thing back and it is still going to be there. The moment you take out the UV radiation, the moment some kind of compromise happen with the treatment, then they are going to write back.
I got you. All right, that makes perfect sense. Uh, so I have another question. It says, if I have a confirmed case of COVID-19 in just one area of the building, like let's say it's on the 3rd floor, do I need to decontaminate the whole building or just that office? And so, I think
Yeah, that's the thing. Like, if it's like, this is a very good question, by the way. So there is two things to be considered. That's why we were talking about, like, the find, focus, fix thing. First of all, we have to be absolutely sure that if you know that like only 3rd area or 3rd floor is contaminated, what is your source of information? If only 3rd floor that person or COVID case is reported, then you have to be considering that whether it is fed by one air handler unit, all the floor in that building, or that was an exclusively that particular air handler was like serving on that particular floor of the building. Whether this air handler was having fresh air intake or it was circulating the air inside the building. So these are the different scenario I said you try, but based on the scenario, I'm just picking one scenario. If it is a known case on the 3rd floor, only one air handler unit is feeding there, then you have to be perhaps contain rest of the area and you can treat that area. But if it is by like only one place, but the air handler is kind of treating the other floor as well, then in that scenario, it is encouraged to consider the other floor also for the treatment. Make sense?
it does. And we would also want to look at how occupants enter and exit the building. So we'd want to look at those surfaces for treatment, elevator, stairwells, rails, doorknobs, bathrooms.
All the frequently touched surfaces, basically, we have to
break
be treating.
rooms.
Yes, break
right.
room, yes.
So that would be good as well. And then we had another question speaking to air makeup. It said, so one of my facilities is 50% outside air and the rest of the air is return ducted. So it comes back in through the return and mixed. In the event of a presumptive case, do I need to treat all of the HVAC?
Yes, if it is connected, you should.
Yeah, so if you just had 100% outside air, so meaning all the air that's being taken out just goes outside,
yes.
then perhaps you wouldn't need to do a deep treatment.
Yes.
Okay, that makes sense. Well, we certainly appreciate everyone being on the webinar with us today.
Yeah, why don't you like write down some question we can answer, because we are literally out of time. So we need to just like, respond those questions privately, right?
That's correct. Both of our emails are on the screen. They're both correct. And you can email us any question. You can continue to type in the questions because we'll retrieve those from the webinar platform. And then, of course, yes, we will distribute this slide deck with the thank you email that will be coming tomorrow. And yes, a video replay of this webinar will be posted on our YouTube channel, and that link will be provided in your thank you email as well. So again, on behalf of Pure Air Control Services, I thank everyone today for showing up, giving us some insightful questions, and keep them coming. We're happy to work with you.
Yeah, thank you very much, and I especially thankful to all those who are joined today from the various part of the world, including like Asia, Europe, India, everywhere. And I know that that part of the world is going through almost well past midnight, and I'm really grateful that all of you have given us consideration. We are here to help you. If you have any question, you can always contact us, as we said, and we will be promptly responding to your question, which we were unfortunately not able to cover during the period of time. Thank you all, and stay safe.